Acupuncture for chronic pain, does it really work? Chronic pain can be a daily struggle that feels impossible to manage. If you've been living with it, you know how exhausting it is to try every possible solution, only to feel stuck without real relief. One option that's steadily gaining popularity is acupuncture. But does it actually work? Or is it just another trend in alternative medicine? In today's video, we're digging into acupuncture's role in chronic pain management. From how it works to what science says, we'll help you make an informed decision about whether acupuncture might be right for you. Let's start with the basics. What exactly is acupuncture? At its core, acupuncture is an ancient healing practice rooted in traditional Chinese medicine, often abbreviated as TCM. It involves inserting tiny, thin needles into specific points on your body. The goal? To restore balance to the body, improve energy flow, often called qi, pronounced qi, in Chinese medicine, and ultimately ease conditions like pain. In Chinese medicine, it's believed that pain or illness is often due to blockages or imbalances in the body's energy system. Acupuncture aims to clear these blockages and restore harmony. It's like giving your body's natural energy flow a tune-up. Even if ideas like qi don't resonate with you, acupuncture still has a lot to offer from a different perspective. Many believe it works by physically stimulating your nervous system and prompting your body to release chemicals like endorphins, those feel-good hormones that help relieve pain. But does the evidence back this up? Let's investigate further. Acupuncture has stood the test of time. It's been practiced for thousands of years. In recent decades, it has become increasingly popular in Western medicine as part of an integrative approach to healthcare. Why? Well, for starters, it's a relatively non-invasive treatment that's considered very safe when performed by trained professionals. Plus, it appeals to those who want a more natural or holistic way to manage conditions, especially when conventional treatments don't bring the desired results. For people dealing with chronic pain, acupuncture offers hope as an alternative that doesn't involve surgery, heavy medication, or invasive procedures. But with all its popularity, it's also normal to wonder, could it be too good to be true? Let's unpack how acupuncture may actually work. From the traditional perspective, it's all about balancing that energy flow or qi in your body. The idea is simple. When energy flows freely, you feel good, but when there's a blockage, pain or illness shows up. Now, if the idea of energy flow isn't quite your thing, don't worry. Science has its own theories about acupuncture. Many researchers believe it works by stimulating the nervous system. When the acupuncturist places needles at specific points, it may trigger a response in your brain and spinal cord. This could release natural chemicals like endorphins and serotonin that act as your body's painkillers and mood boosters. Some studies also suggest it may influence pain perception by interacting with sensory nerves in your muscles and tissues. These are promising ideas. But does this all mean acupuncture is the real deal for chronic pain relief? Before we get to the hard data, let's look at the kinds of conditions it's reportedly helpful for. People typically turn to acupuncture for conditions like chronic back pain, one of the most common reasons people seek acupuncture. Many swear by it as a way to reduce pain severity and regain mobility. Migraines and headaches. Some studies suggest regular acupuncture might reduce the intensity and frequency of migraines. Arthritis or joint pain. Acupuncture has been used to manage osteoarthritis pain, especially in the knees. Acupuncture for chronic pain. Does it really work? Neck and shoulder pain, a popular focus for both office workers and those with physical labor jobs. Fibromyalgia and nerve pain. While more research is needed, some individuals have reported relief with acupuncture. These are just a few examples, and results vary depending on the individual and their unique circumstances. Now for the big question. Does science back up acupuncture's claims? The answer is a little mixed, but there's a fair amount of support for its effectiveness in managing certain kinds of chronic pain. For example, a 2012 analysis in the Archives of Internal Medicine reviewed multiple studies and found that acupuncture provided real pain relief for conditions like back pain, neck pain, and osteoarthritis, beyond just a placebo effect. Another review published in JAMA, Journal of the American Medical Association, found acupuncture to be helpful in chronic headache and migraine relief with noticeable decreases in symptoms. That said, Not all studies are conclusive. While some show promising results, others suggest acupuncture's effects may not be substantially different from sham acupuncture, in which needles are placed at non-traditional points. This has led skeptics to believe some of its benefits might come from a person's belief in the treatment or the placebo effect. Even so, many medical professionals agree that something about acupuncture is working, whether it's a direct physical effect or a combination of physical and psychological factors. One of the reasons acupuncture appeals to so many people is that it's generally very safe when administered by a licensed and qualified practitioner. The needles are so thin that they rarely cause pain, though you might feel a mild tingling or dull aching sensation during the process. Still, as with any medical procedure, there are risks. Minor bruising or bleeding at needle sites. Feeling lightheaded or fatigued after a session, but this is temporary. Rarely, untrained acupuncturists could cause complications like infections or injuries. This is why it's crucial to see a certified professional. If you're pregnant, have a blood disorder or take blood-thinning medication, talk to your healthcare provider first to ensure acupuncture is safe for you. If you've never had an acupuncture session before, you're probably wondering, what's it actually like? First off, rest assured that it's not as intimidating as it sounds. Here's a breakdown of what typically happens. Consultation. Your acupuncturist will discuss your health concerns and medical history. 2. Treatment setup. You'll lie down in a comfortable position as they identify the points to treat. 3. Needle insertion. The needles are thin as a strand of hair and they're usually inserted a centimeter or two into the skin. Most people feel little to no discomfort. 4. Relaxation. Once the needles are in place, you typically rest for 20-30 minutes while the treatment works its magic. Many people report feeling relaxed or even sleepy after their session, another reason acupuncture is so appealing. Acupuncture doesn't have to be an either-or decision. For many patients, it works best when combined with conventional medicine. For example, pairing acupuncture with physical therapy, massage, stress management tools, or medication can deliver a more comprehensive approach to pain relief. Communication is key. Discuss your plans with your doctor to create a treatment strategy that fits your needs. When considering acupuncture, the cost is another factor to keep in mind. Sessions typically range between $50 and $120, depending on your location and the practitioner's experience. Many insurance plans now cover acupuncture for certain conditions, so it's worth checking to see if your sessions might be at least partially reimbursed. Also, finding a reputable acupuncturist is essential. Look for practitioners certified by credible organizations like the National Certification Commission for Acupuncture and Oriental Medicine, NCCAOM, in the United States. Reviews and testimonials can also help you identify trustworthy professionals. So, is acupuncture worth exploring? If you're dealing with chronic pain and open to alternative solutions, the answer might just be yes. It's non-invasive, has minimal side effects, and offers the potential for pain relief when other methods haven't worked. Plus, even if the effects vary from person to person, the relaxation aspect alone can be beneficial. Of course, results aren't guaranteed for everyone, and it's important to enter the process with realistic expectations. Acupuncture is often part of the solution rather than the ultimate cure. Look at it as one piece in a larger puzzle of health and wellness. Acupuncture is one of those treatments that bridges tradition and modernity. It's as much about addressing the root causes of pain as it is about embracing a holistic and balanced approach to healing. For some, it's the missing piece of their pain management journey. For others, it might serve as a helpful complementary therapy. If chronic pain is holding you back and you've exhausted other options, why not give acupuncture a try? With research-backed benefits and real-world success stories, it could open a new chapter in how you manage your pain. And who knows, it just might redefine what healing means for you. If you found this video helpful or have questions about acupuncture, let us know in the comments below. Don't forget to like and subscribe for more videos on alternative medicine and holistic wellness techniques. Together, let's explore pathways to healthier living.